Hello, everyone. Welcome to our second WHIS Talks. Today we are called Say It As It Is, and it is a fitting rebranding for today's session. You have with you myself from Cassandra, Julie, whom you know already from Start Change, David, whom you know already from DJK Global, and our brilliant guest that we'll introduce a bit later. Today we're going to talk about mental health, and we believe it's a topic close to everyone's heart, so don't hesitate to share your questions and comments in the chat, and we'll pick them up as it goes. Now, time for the introductions. We are privileged to host Isaac Samuels OB today. I looked at Isaac's different profiles online, and they're basically everywhere doing everything all at once, but mostly it's always about social justice, inclusion. And what I read quite often was that you believe in the power of voices and narrative. Yeah? Okay. So I'll kick us off then with the first question. You know the drill. This is a relaxed conversation and we're all friends, but I'll just kick us off here. I remember, Isaac, while we were preparing for this chat today, we asked you a little bit, what's your point of view in mental health and so on? And you had a very, very good formula saying, well, long story short, we should aim for people to thrive, but the current system is barely allowing them to survive. And I thought that was a very good way to set the seed for a conversation, if you want to elaborate a little bit on that, Isaac.
Yeah. So I'll just go back to like the reason why I'm in lots of spaces is because when you advocate for mental health, so when I advocate and people agree with what I'm saying, I'm celebrated and welcome. If I am really honest, when I talk power to truth, it's very easy to be uninvited. So I've learned to do social justice, you need to really be in lots of spaces. And when we really talk about mental health, my own experiences stem back from being conveyed in the back of a police car, being injected forcibly, spending time on a mental health ward. And in that moment, the distress and trauma was really, really present. But the really profound thing is I live in a very diverse borough. And when I looked around at other people in that space, there was a disproportionate representation of Black men. I'm a dual heritage person. I'm privileged from being closer to whiteness than Blackness. My experience compared to some of my Black brothers and sisters is very, very different. And it gave me a fire in my belly to think about how do we really make sure that mental health support systems and services and people in these spaces really understand the trauma that people have experienced and the lives that people deserve to live are really important, but there is a reality rhetoric gap. So we talk about all of the stuff around like mental well-being. We've had the initiatives and governments and policies and procedures. But if people are still having experiences where they're just surviving, for me, that's not a good indicator of mental health. That isn't a good indicator of societal mental health. And if you happen to have different living experiences, the likelihood is that you will have poorer outcomes. And let's be honest, when people say to me, well, haven't you done well? You've got this. And I'm like, hold on a second. All of my siblings, all of the people that have not had mental health challenges have that stuff. They don't get celebrated for that. It's just everyday kind of experiences. So I want a world that sees that people with severe and enduring mental health challenges can re-author their lives. Their stories are important. They are important. They're loved, and they deserve better.
Yeah, I agree. I think that, You know, we go back some way, Isaac, and so I totally get where you're coming from, particularly that you touched on the disproportionate of black men in the mental health system. That's something that, as someone that works within social justice and has been for many many years, it's always been for me around black men, because I really do see what it's doing to our youths, having black men in the criminal justice system or the mental health system within the criminal justice system. And a lot of black men are, you don't walk down the road these days and just easily see. You have to be in pockets of different diverse communities to actually spot a black man walking up the road safely, because many 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 are in prison, and it's actually affecting their children's mental health and mental well-being. And we wonder why, you know, that we have, there's mental instability when people are killing each other, and our youth are doing that because of their mental well-being is not good. And that kind of sometimes a high percentage of that, I would say, comes from the fact that they don't have relationships with their father, or it could be their mother. The fathers that are in the criminal justice system and mental health system are giving up because the systems that we have are not designed at all to support our communities in the manner that we need the support for.
So just here to make sure I understand and putting myself in the shoes of people who were not part of our previous conversations. When
Mhm.
I feel we're talking about two things. We're talking one about the fact that black men who are overrepresented in the criminal justice system and in the mental health system, that creates a new set of problems for the following generations. And so that's already
Absolutely.
not setting up the next generation. But I'd like to understand, when we say they're overrepresented, are we saying there are more black men in the criminal justice system and in mental health facilities than there should be? And if so, then why is that?
Well, it is a well-known fact, that they are overrepresented. It is a well-known fact. It's well known to government. It's well known to policy developers, policy analysts. It's well known to those that work within the mental health system.
And this linking to a stigma and a difference of treatment because they're black men, not
Absolutely,
okay. Yes, that's why
absolutely,
I wanted to
and
highlight. It's not
yeah,
a deserved
yeah,
treatment. It's stigma that places them there. Which,
absolutely,
Yeah.
absolutely. I don't know if you have a view on that, Isaac.
Well, I think stigma is something I think is very, very present, but we have to think about this. And I'm not immune to that this space there are different people. And when I talk about whiteness, I'm not talking about individuals, I'm talking about systems of oppression. So we often will go into this thing around stigma, we'll often go into this thing around representation, but we have a history as a country where we have benefited from slavery. We have
Absolutely.
benefited from the fact that many people have been othered Many people have poor experiences, and some people benefit off of those experiences. So we might, that legacy of slavery, in my opinion, and it is just my opinion, has meant that we have continued to treat people in a particular way. If you think about the medicalization experience or the medical experiences of Black people, so rooted in seeing them differently. The fact if you are a woman, a Black woman, you're more likely to die in childbirth or have challenges. If you are a Black man, you're more likely to end up in a criminal justice system or in a mental health system or have a communication challenge. Our young people are directly experiencing the legacy of colonialism, racism, slavery. It just has manifested itself in different ways.
Absolutely.
And oppression continues. So the reason I do social justice, one, was never for myself at all. And it was really thinking about, I have loved ones that I worry about their future. I have people in my life that I think, if you walk down the street, are you going to come back to the house and be here with us? And the reality is that many of our young people don't come back because this stuff plays out on our streets. And I found spaces to kind of start to talk about that. And I'm going to just say, me and Julie, people roll their eyes. We have had hate emails. We have been told that we are Black and brown people that are talking about racism. We've had it all. We paid the consequences of talking out about the fact is that we have benefited as a society by othering and treating people unfairly. And if we want a society that people can thrive and not just survive, we need to be uncomfortable. We need to do something different. I don't want, my loved ones to have the same experiences that I did. I don't want to be seeing that my nephew and I'm just about to launch a piece of work around reclaiming the space around suicide prevention. And actually, there's a lot of talk about suicide prevention, but if you look at the people talking about it, it's often white people, it's often bereaved families. And I'm not saying that's wrong. What I'm saying is there is space for us as well. How do we create space for us? We're not taking your space. I don't want to take your space. I want to be in space with you. I want to be in dialogue with you because you have power, you have resources, you have gifts. Collectively, we can solve the problems that were created because of, colonization, because of slavery, because we have a medical system that sees our pain differently than it might see other people's pain. And Roxanne, I know you will know this as a woman. You will have experienced this as a woman. We all experience othering in some way. And I think if we can connect into where have we experienced that and how can we use that to create some change?
Yeah.
There'd be so much to change about society. I'm very glad that we're all of us here today and we're having this difficult conversation, because that's exactly the point, is to make a safe space for this conversation where everybody might feel a little bit awkward and uncomfortable, but it needs to happen because that's then the start of the change. Pun intended for you, Julie, and start change.
Yes.
But as you were talking, I was thinking, the NHS recently published the renewed women's health strategy, and they call out the mortality rate of Black women in childbirth. They call it a national shame, and it's the first time I see a document who is not shying away from the issue and who's there are numbers to it. There are systems in place to prevent it, or like there's clearly unintentional. They can't shy away now. They've called it shameful. I wonder if that's something we see, and there's this similar vibe for access to mental health. But in general, and when we think about mental health, do we see that same realization from the government, from institutions, from providers, and that inequality of access or ill-fitting care? And
No.
why not?
No. Can I bring David in?
Yeah.
I'd like to bring David in.
Absolutely. Thanks. And I mean, this is very hard hitting stuff straight away we're touching on here. And I mean, obviously coming from a white background, being white myself, this does teach me many lessons and open many things to me as well that I don't experience myself. Where I draw parallels, Isaac, from a lot of what you've mentioned is, I think we discussed on the last call, I did have traumatic brain injuries from being hit by a vehicle when I was a teenager. So I went through a brief but traumatic experience where I had to recover from those brain injuries and get back to life as normal. But if anything, I don't remember the incident, the accident that left me with brain injuries. What I do remember is my time in the hospital when I saw other patients who had similar brain injuries to myself, but the physical manifestations of those injuries in them was unfortunately much worse. So they weren't able to make the recovery that I did. And I've seen the incredible work that the people in the hospitals can do to help people recover. So some of them for years to go through all that work to get back to life as we know it, just for the system to be there that isn't fit for them, that is only fit for your regular working people. It almost knocks back all the good work that's done to help those people recover in the first place. So similar, like you said about the fire in your belly, Isaac, coming from your hybrid upbringing, I've had that experience and I've seen what people that don't make that same recovery, the system just isn't there for them. After all that hard work to come back, it says, you're disabled, you stay in your box, we'll look after you, let us get on with the job here. And I think something else that struck me is the fact that in the last generation or two, mindsets have massively shifted towards being more inclusive, understanding, and seeing as a national identity, somewhat irrespective of colour. Still a long way to go, but it has massively changed over the last generation or two. What hasn't changed is the system that was generated post-World War II that we're still working on in this day and age. So what can we do then regarding mental health access as well, particularly? I think making education, raising awareness, creating noise, like the paper you said about Roxanne, how can we draw the link and bring that back to the public sector to implement or to push for that change?
Yeah, Isaac, and then I'll come in after Isaac.
I think when you're as wise and old as I am, and I've been around a long time, I know, so I often talk about being long in the tooth. It's really easy to highlight the problem. We've heard the problem. We know the problem. The problem that we have is sometimes how we do the doing. So, David, I just wanted to honor your sharing there, because your experience is a point of connection that we can connect on. And when I have these moments of I'm saying this is not good enough, there is a lot of pushback because we're scared of saying that our public services are not good enough. I'm not saying our public services are not good enough. What I'm saying is they could be better.
Yeah, and absolutely.
And for some people, then they're not good enough. I'm not saying this nurse and human beings, we take things very personally. So when I, challenge and someone say, well, you're saying all social workers, all mental health professionals, all people, what I'm saying is push beyond the ego that we all have. I have that ego, we all have that ego, and think about how do we create a world that's fair and equitable, and it's not about policy and procedure alone. My friend and colleague said, Isaac, you're a doer, but actually to do, we need three things, I think. We need one, love, compassion, as one thing. Two, we need policies and procedure, but we need that living experience of good to be the thing that we aim for. So we can change policies and procedure, and that enables us to do this stuff. But unless we're honest that the point of connection has to be that it's just not working for lots of people, and there's lots of harm that's happening. And the more harm that happens, and I'll come to you, Julie, you know, I've been in spaces where you've been harmed, and you're in that space advocating for Black and brown people because you are passionate. But I know that the effect that has on your spirit, I know the effect it has on your body, but you still do it, you know, like, because what option do we have? We don't have an option.
Right. Yeah. No, you're right. I've felt it, and the negativity of people that, when you say it as it is, your life experience, your lived experience, it's not always what people want to hear. And when you have lived experience of living with mental health, which we all have, but when it becomes unwell, there becomes a problem, because it's not that services are bad services, it's just that services need to change. The system which the service sits in has to change. And I think that until that actually happens, no policy in the world is going to help. No policy. You have to have those around the table that experience the pain, that experience the trauma, no matter how uncomfortable it could be, and those that advocate for individuals and advocate for themselves. We're often seen as people to be frightened of, and that should not be the case. We should be embraced because we want to change a system that is broken, that is not working. And I'm very passionate about social justice, as is Isaac, and that was my reason for developing Start Change, because I'm passionate about the fact that since there was a report, I'm going back a few years, the Macpherson report. And the Macpherson report came out after the murder of Stephen Lawrence. And that Macpherson report, I think it brought out 356, what they call it, areas that had to be fixed in other ways within the criminal justice system and mental health system, because it was affecting Black men. Now, hardly any of those recommendations were met. And so it's a continued, it's a continued journey of discrimination that and exclusion, that even the Black man without the mental health or unwell, he would know somebody that's unwell. And when the system does not fit, it really doesn't fit. And that's when we see homelessness. That's where we see a lot of things going wrong in people's lives. Roxanne.
Yeah, as I listened to you in the conversation, I felt that maybe the difficulty with mental health is that so many of the mental health conditions and mental health issues are in fact generated by all the flaws, to call them only that, in the way our society is built. And it's so there's a higher prevalence of mental health condition among women. There's a higher prevalence of mental health condition among people who are poor, poverty is linked to higher risk of mental health.
Mm.
Racism is also generating mental health. So I feel it comes from society, and then we're having to go back to society to get better. And of course, there's going to be a lot of ill-fitting services, because those services are also a produce of that same society that created the problem in the first place.
Yeah.
And maybe that's why mental health is so tricky. And then there's it takes so much courage to seek out help. And then another layer of courage to accept the help when it's accessible. That there's really barriers at every stages when we're talking about mental health. And I remember, Isaac, you were saying communities might be the best preventative measure. I'd love to hear you expand on that and on the role that trust can foster in all of this.
Yeah, so I'll just give an example. Last night I received a phone call from someone that was struggling, didn't think that they would survive the night. And I said, why have you called me? Like, not in like I said, like, thank you for calling me. Like, what can I do? And they said they just didn't feel that they could reach out to, and they had called the crisis team, and the crisis team had told them to go and have a bath. And so I'm listening to this person who feels like they don't have many options. And I did something that the community taught me, was ask them to help me. I didn't help them, I asked them to help me. And I didn't fix them. I don't want to fix them. I listened to them, and I thought about what would I want in that moment. And I'd want someone just to listen to me, be there, and maybe like really understand that in these moments where people find it really difficult, there is a reason why people find it difficult, because the response that we probably all have is thinking about our local health and care systems, our welfare systems, our systems. Those systems are not, their systems are not humans. What people need is human connection, to find moments where you can just connect, where you can talk things through. And I would love the discourse to change. I'd love to stop talking about mental ill health and mental health, rather to how do we create health? How do we create as communities, health creation is really important. Communities are places where we live. They're important to us. There is a lot of power and knowledge. When we are in crisis, when we are in challenging times, people show up. Local people connect over the most interesting thing. So this man who I was speaking to last night, I just asked him to do one thing. Would you mind dog sitting for me next week? And that's me asking him to do something really thing. And I knew that person would really just think about it. And I said, also, do me a favor, can you check in with me tomorrow? And they're the little things that make a difference. That person checked in. When they joined the call, they felt that they had no other options other than to think about, ending their life by suicide. And the things that I've learned are not from systems, they're from human beings. Yeah. I'm not perfect. We're not perfect. We're not always get it right. It's being able to be clumsy. It's being able to be brave. It's being able to be really human. And David's point around his own experiences is when we can share our experiences, those experiences can create gateways for other people to connect. Those experiences in our communities, those intergenerational relationships, those relationships between different people, different identities, so important. And create an opportunity to really think about, I have something to give. I have some purpose and meaning here. So the communities, the place that I think that we solve some of this stuff. We cannot continue to look at systems that don't serve us well.
Yeah.
But we also, and I'll come to you, Julie, in a second, we also need to be really mindful of people like David, really mindful of people like yourself, really mindful of people like Julie, really mindful of people like myself, because what we are, and I don't know if anyone's come across the community-based kind of approaches, the people that fill the gap. So Julie is someone that has connections to hundreds of people. If I need something, I'm going to Julie. Julie, I don't know this problem. Da, da, da. David, you're probably the same person. It's the people that are the infrastructure to supporting good. We are the gappers. We are the community. We are the people here. We feel it. We breathe it. We love it, and
Yeah,
we're the solution.
yeah, we are. I absolutely agree. I think that, sorry, Roxanne,
Go ahead, Julie.
I think that it's time, you know, like, it's time for change. It's time to have difficult conversations like what we're doing now. And I'm hoping that we have an audience that can understand or overstand, as my father used to say, overstand that the fact that we do have a voice as a community, black, brown, white, we do have a voice, and collectively we come in numbers, we come in strength. And I think that the problem that we have with the system is afraid of the numbers, the impact, the strength that a community's voice can bring. Now, lived experience and I know with my lived experience and my continued living experience of being unwell through mental health, living with bipolar has been a journey, a difficult one. Having been sectioned, I think 3 times, and having gone in twice voluntarily. And it leaves you with a feeling of feeling ashamed of yourself, because when you actually, I don't know if I'm speaking out of turn, but I'm going to say it, that when you're in the system as somebody who's mentally unwell, you're not treated as a human being. You're treated as somebody that's mentally unwell, whereby there should be a journey to get you out of that kind of mindset. And that journey often doesn't start until you leave the system. And when you come out, there is another system, and then another system you've got to go through. And that was one of the things that I also felt strongly about and wanted to speak about today. But I won't, because I know that we don't have much time. But people that identify as a disabled person, that have long-term conditions, have physical impairments, and live with unwell mental health. The system, again, it's not built around the holistic person. It's built around boxes. And although it is said within, clinicians will say, mental health clinicians or a GP even would say, well, you know that your physical health can affect your mental health, then you go into the therapy stage with a psychotherapist or a psychiatrist, and they will say your mental health affects your physical health. But yet, if that is the case, which we know, yes, I personally would agree with it for some of us, but if that is the case, where are the services for that? Where are they? So where are you going to send me?
I fully agree with you, Julie, on that. And again, it's no fault from the people who are in the system. The system is probably doing its best, and it's also heavy things to change. But when I've seen the system work, taking into account mental health and physical health, it was never by design. It was always resting on the initiative of an individual getting it. I've been lucky enough in my journey to meet these people. I don't know if they'd like me to name them, but thank you. They know who they are. And I fully agree with you on that. I want to come back to that on how you look after your physical health when you have mental health. But I also wanted to comment on communities and communities being a safe harbor. That has not been my experience of communities, and I'm sure it is not for a lot of people who feel marginalized and who feel that they don't have, even in their own family, they don't have a safe place to be, a safe place to exist. So on the one hand, I see the power of communities, but I'm not sure how we realize it and tap into that power without what you called, Isaac, in the past, radical kindness and radical imagination.
One of the things that I think we cannot deny in this space, and that will be present here, there is a vested interest in division currently. And if we play into that narrative, there will be less. And Julie put really spoke the words of the power that comes from living experiences and community. And yes, community has struggled for many years for various reasons. We've had infrastructure taken away where people might meet. We have had division, racial, gender, all of those things play out. That's undeniably. But that serves some people, not all people. And I suspect if we really focus on strengthening and building community, that is one of radical kindness, which is one of compassion, which is one of making sense of people's living experiences. As a disabled person, as a person with mental health challenges, I'm always having to educate. As a queer, brown person, educate. That is tiring. But I think if we can collectively come together, we've already built a community here, right? We've built a community here. Let's invite another person. Let's invite another person. And, it takes a village to grow a child. It really does. And if we look at the systems to grow the child, we're really focusing in the wrong place. And I'm not denying your experience. I've had those similar experiences, but I've also been able to find communities of interest, communities of solidarity, communities of love and compassion. But it's hard work. None of this kind of stuff is easy. And the more we talk about it, the more I think people will connect with it. Yeah. And there is a tension, I think we in this space might be worrying about saying that systems are really crap and people are really crap and all that kind of stuff. Systems can be really not very good for people. And systems are made up of just people. And I've had hundreds of people that have just been wonderfully kind, generous. Yeah. And if they can support another person to understand this is the way you need to be, then you've got 2 people, then you've got 3 people. And maybe you build that.
Yeah. Do you want to come in, David?
Yeah, I suppose there's really some fantastic points being highlighted that I've just been jotting down here to make sure and highlight throughout the call. And I mean, like Roxanne was mentioning there about the community and how we come back to the community to really help us. I mean, even after my own accident, the hospital did incredible work with me, but at the same time, in the long run, is being so close with my parents and how supportive they've been after that to help me get back to normal after that. That was what really, that was my community, and that's what really enabled it for me. But I think one important thing I keep in mind as well is when it comes to being the community, you know, like you said, Isaac, it takes a village to raise a child. But at the same time, and I learned this the hard way myself, you have to look after yourself before you can look after others. If we give, it comes back to us eventually. We have to look after ourselves. And in doing that, we need to be reliant on the system to help us keep our health and actually challenge us. And in that fact, that's where coming back to, like Julie mentioned, that we can have all the policies and apps and whatever in the world. It's not going to work if it plugs on, if it's an appendage to the system. It's not changing. It's not having impact. We need that inclusion, that education in the infrastructure and the system from the ground up. And then a system that's been around for a lifetime, for more than a lifetime. How on earth can we do that? There is people trying to do it, but how could we do it effectively? And coming back to a point you made then, Isaac, this is where this comes in perfectly. This is where we have to look at health creation.
Yes.
And mental health fixes, for lack of a better way of putting it. How can we do that? And this brings in social prescribing. And that's the model we know we need to look at shaping now. And we do have the communities to enable this. The communities to create it yourself, Isaac. And then, of course, that was the exact ideology behind the WHIS community, to create that community platform where we can really enable successful social prescribing. And I think that the most thing we can do, like everybody here has said, is to make noise, to come together. The system isn't going to change itself.
No.
People need to step up. We need to step up. We need to be heard. We need to understand we don't work to serve the system. The system serves to work us. I think a lot of people forget that, though. So I think, Isaac, you're doing fantastic work in that area.
Yeah, yeah.
Well, no, we all are, and that thing around, and you're so right, David, that radical love has to come with radical love for self. And that's really hard if society hasn't shown you that love. So one of the things that I'm often, and people like get very uncomfortable because I'm talking about love and a bit fluffy, but actually loving oneself enables you to love other people. And the love that I've had to, and it isn't and hasn't come easy for me, the love that I've learned for myself has been taught by people. People have invited me to really think about, how are you looking after yourself? How are you loving yourself? Even in days where I feel loving myself is very hard. And then how do you take that love and then you share that love around? And that radical, I suppose, community care, because it's not just self-care for me. It is really about how can we collectively come together using everything. There's no one way. So there'll be social prescribing, there'll be solidarity spaces, there'll be work on health creation. And sometimes we create hierarchies of marginalization rather than we think about, if we start to do anti-racism work, if we start to do health creation, that doesn't benefit one group of people, that benefits everyone.
Yeah.
Yeah.
Build
Totally
for
agree.
one, implement for the many.
I love that. I do want to stretch that point again. It's about putting your oxygen mask on first. And I felt in women's health and in women's mental health, that's repeatedly what we see. We talk about maternal burnout, and and there's a lot where the communities rest upon women, but then the women are supposed to pour from an empty cup, and I think that's I think that's the power as well of social prescribing, is that you're outsourcing that load of, and now on top of it, I have to find my community and build my community and all of that, which is extra work that you don't have any capacity for. Yeah. But then if that can be outsourced via social prescribing and communities proactively doing outreach, that starts looking like the beginning of a solution.
Yeah.
Yeah, I agree. I think that social prescribing has been, it's not new. It used to be called community advocacy outreach, people advocating for each other. It's now social prescribing, but it's more managed. Yeah. And I think that it's certainly the way to go. Social prescribers are in the community. They support people in all a manner of ways, all a manner of ways. But what we don't want is for social prescribing to be part of a particular system. We want social prescribing to be social prescribing, and we'd like the inclusion of people with lived experience as social prescribers. We'd like the inclusion of others from different communities and different backgrounds and different races to be social prescribers, different cultures to be social prescribers. And I think that with the work that's being done, with the world, with the work that's the Global Social Prescribing Alliance and what's happening in the UK, I think that it's going to be really good, and that it's got a positive journey that can be implemented. Yeah, I think that social prescribing is certainly one way to go. But I agree with Isaac, there's not only one way, there are many ways.
100%.
And when you have communities that, let's say, require trauma-informed care, can a social prescriber actually refer somebody to have trauma-informed care? We don't know, but we can make sure that we support the social prescribing movement and add to the expertise of the people on the ground, because they are the ones on the ground advocating. Yeah.
Yeah, I'm happy to jump in here. When we're talking about trauma-informed care, if anyone who's listening to us doesn't know, it's not about healing the trauma. There's the work you do around it so that life is still possible and that care is possible despite the trauma. And I can give you a very tangible experience of what it can look like. I've been a victim of sexual violence in childhood, so I carry heavy trauma. I also have an increased risk of gynecological cancer, which means on a regular basis, I need internal examinations. So the two things don't go too well together. It means every examination is extra difficult for me. And in the system, there's not much that is proposed, but there is enough room for individual initiative to adjust. So I've had practitioners offering me alternative positions, like if I'm not comfortable lying on my back, I can choose a different position. I've had practitioners offering me a mirror so I can know exactly what's happening and when it's happening. I've had practitioners, because I was in tears and in tears and in tears, it was just push through, I want it done. And I had the practitioners stopping themselves and said, look, I'm not comfortable with that level of pain, whether it's emotional or physical, I'm deciding to stop. And by protecting themselves, they're showing me this is a space I can trust. This is part of my community. And that's the many different ways trauma-informed care can exist. And that's taking into account mental health, not as yet one more dimension to look at when you're doing physical health, but just how can I respect, almost welcome this mental health condition and make room for it so that life can keep going as much as possible.
Beautiful. And thank you for sharing something that many people may connect with, many people may find hard, but that sharing, and I think it goes back to the more we share, the more we use our lived experiences, the more that shapes the way that people show up and behave and respond. So I often talk about trauma responsive approaches, is because sometimes we're asking people to do stuff they just don't know how to do. And it's for us to show them sometimes that and use our experiences to create difference. Julie will probably email me off saying, Isaac, you're starting another campaign, etc., etc. Why are you doing that busy? Because if we don't do this stuff, I feel no one's going to do this stuff. So every individual is a change agent. So every individual creates that change. And where I see creating change isn't a really difficult thing. It's like how we amplify our voices, how we ensure that other people hear our experiences, how we don't shame people into responding, but we invite people to be curious about what could they do differently. So this thing that I'm doing around kind of the racialized experience of suicide prevention came out of a place of me really not knowing how to respond, sitting with my own illness, and then thinking, well, actually, if I don't know how to respond, then let's work it out together. How can we collectively build a resilient, a trauma responsive, a humane response that is going to serve more people? An example, I think, really illustrated that sometimes we have to give, even knowing that giving is painful, even knowing that when we're giving, that we're not sure if that benefits other people, but knowing deep down inside, you're hoping that it benefits you and it benefits someone else. And I can assure you that clinician would have benefited in their practice and probably now does that with everybody they come across.
Yeah, I agree.
That's the hope. That's the hope, absolutely. I've learned to give them feedback when they're helpful in that way, to explain why it's important to keep doing that thing.
And David, can I ask you a question?
Of course.
So you talked about sort of family, and you also talked about, you know, your own history, your own experiences, social prescribing. That for me, social prescribing is many things that we could do, but I just wanted to talk about like purpose and meaning. So like purpose and meaning is so important. Like, and I wondered what it meant to you, like, and how social prescribing fits into people finding purpose and meaning.
Well, the way I personally look at social prescribing, and it was Gareth at WHIS that helped to shape this for me, is understanding that no, the system is bad, but it's not fit for the populations that we have in this day and age. And it's often the follow-up from the system through initiatives, whether it's in finding jobs. I mean, what we're speaking about here today reminded me when I was in my early 20s, I was trying to look for something to do with myself. I went to an initiative, a charity called Job Care in Dublin, here in Ireland. And I went in there doing bar work at the time, throwing out cocktails. And a couple of months later, I was suited and booted with a tie, attending business events and networking. And that really started me on an incredible journey. So that versus going to your local social services office to try and see what jobs they can throw at you, or whether it's been through mental health, such as what's been discussed here today. It's understanding that being preventative rather than reactive, how can we shape it so that the healthcare system isn't just saving money and not having to look after people as much, but it's actually providing better services by keeping people healthy in the first place. And this is where, and I mean, having a 12-year-old and a 7-year-old myself, and understanding the mental challenges that unfortunately at that age you face day in, day out. The means are there, the initiatives are there, the people are there. They're just not part of the system, so that they're not the go-to. So, for example, I had a good friend I train with regularly at the gym. That's how I know him, just through the gym. And he's come through some pretty severe mental challenges himself recently. And he ended up getting flung into a social ward. And he said, after a day or two, he's like, okay, I'm better. You can let me in now, because it wasn't a nice place for him to be. And they said, well, if you want to leave here, you're going to go to the police station. So do you want to be here? Do you want to go to the police station? Wasn't a nice journey, but eventually got through it and he got back out. But long story short, there's so many other initiatives and people and programs out there that he didn't know about, that the system didn't say. And said, okay, you're leaving here now. We trust that you're not going to do harm to yourself or to someone else, but go talk to these people. Go talk to this person. That just didn't happen. He came back and spoke to me at the gym, and that was it, So social prescribing is where the means are there. The initiatives are there. Let's connect people with those initiatives. Let's fund those initiatives to amplify the work that they're doing instead of a health system. And this was something I think you pointed out, Roxanne, it was Julie. It was Julie that pointed it out. The system looks at people as statistics, as boxes, you said, Julie. Initiatives look at people as people. This is the move we need to make to shift.
Yeah.
For me, that is social prescribing. And for the next generation, upcoming generation, the generation after them, my children, I want to see that change.
Yeah. When we started this panel an hour ago, Isaac introduced himself as somebody with dual heritage, and I really do respect that, because I think that people with dual heritage have had a bad deal. They've had a bad deal. And I say this because I have 3 grandchildren who are of dual heritage. And they're more into their blackness than what they are their whiteness. But yet they've been brought up to love both. Otherwise they can't love themselves. And it concerns me. Their mental health concerns me, because although they have mental well-being, and I hope that continues, if it doesn't continue for somewhere along their journey of life, I would like to think that maybe a social prescriber is going to ding, or somebody that understands the dual heritage side of them. And that concerns me, because I don't see any services that are in place for people of dual heritage.
It's funny, Judy, because I didn't know you would pick up on that particular point. The point and Roxanne's point around places where we might seek to find support. So growing up brown, not white, where do you go? Which group do you fit in? Being a person from the LGBT community, being a disabled person. There have been lots of places that are supposed to be for me that haven't necessarily been there for me. And it's how we create those spaces where we can connect to people like us and create different kinds of spaces. And we both live with long-term health conditions. The mental health is one thing. I'm often in spaces where they have no understanding when my body's just not working, what it means to get there, or they might focus on this bit. But actually, if you think about the whole person, their whole experiences, then I think you're doing justice to the person, the experience. And a lot of spaces are so binary, aren't they? That lots of conversations we have are so binary. They're all about polarization. And let's think about the current position that we're in. I love young people because young people are showing us the way that let us be brave, let us be more conscious about the way the world hasn't served so many people well. Let us be anti-racist. Let us be conscious of, you know, misogyny and how that plays out. Let us be conscious of the environment. And when we start to think about those things, I think we start to create spaces where it doesn't matter where you come from, who you are, you might have a chance of just being able to be in that space.
Yeah. Boom.
Exactly. Boom. Beautiful.
Brings us to the
way
end.
to conclude. Yeah. And thank you to everyone who watched. Thank you so much, Isaac, for your contribution. I do hope this was the first of many with you.
It will be.
Good. And we see you all on the 30th of June for the next episode that will be on women's health and AI. Can AI be the answer to that stigma and data gap that we have in women's health, or is it just amplifying the problem? That's what we'll be discussing. You gave us a lot to think, Isaac. I would hope for everyone to remember that one, it's okay not to be okay. It happens to everyone. I think by sharing all of our experiences, we found out we've all been there one way or the other. And two, that there is someone you can reach out to. It might not be always exactly your next door neighbor or just in front of you, but there is someone, and at the very least, there would be us. So don't hesitate to write to us. You can find us on LinkedIn or at info@whis.com, I believe. Oh, I'll check that. I'll put it back on LinkedIn for everyone to see. WHISworld.com. Thank you, David.
WHIS.world. WHIS.world.
WHIS.world. Can I just add a final thing? So thank you for holding this space with integrity, compassion. Thank you for all of the sharing. And I will be back, but just reminding people that these conversations are conversations that bring stuff. So whatever you can take from these conversations, take it, use it, listen to it. The richness is here.
Thank you. Thank you, Isaac.
Thank you.
Thank you, David. Thanks, Roxanne.
Thank you.
Thank you.
Take care.
Keep well.
Bye all.
Bye.
Bye-bye.
Take care, folks.